Normal anxiety. Normal anxiety is a natural response of the body and mind to challenging, threatening, or stressful situations. For example, when facing an exam, an important presentation, or a major life change, we usually feel nervous or anxious. These feelings are actually beneficial because they help us become more focused, alert, and prepared to face the situation. Normal anxiety is temporary and usually disappears after the problem or difficult situation has passed. If the anxiety felt does not interfere with daily functions and is not excessive, then it is considered healthy and normal. Generalized anxiety disorder. Generalized anxiety disorder, or GAD, is a condition where a person experiences excessive and almost constant worry or anxiety about various aspects of life, such as work, health, relationships, and other daily issues. These worries are disproportionate to the actual situation and difficult to control, even when there is no real threat. People with GAD often feel restless, have trouble sleeping, get easily fatigued, have difficulty concentrating, and this constant anxiety can lower the quality of life and productivity, as the mind is always filled with worries without clear reasons. Panic disorder. Panic disorder is an anxiety characterized by panic attacks that occur suddenly, without warning, and are very intense. Panic attacks usually last for a few minutes, but they feel like a very long time for the sufferer. The physical symptoms that appear during a panic attack are very intense, such as a racing heart, shortness of breath, dizziness, cold sweats, trembling, and a feeling of numbness or tingling. Additionally, sufferers often experience a deep fear of sudden death, losing control, or having a heart attack. Because these attacks are very frightening, sufferers often develop new anxieties about when the next attack will come, leading them to start avoiding certain situations that are thought to trigger panic attacks. Phobia. Phobia is an extremely strong, irrational, and specific fear of a particular object, animal, or situation that is not actually dangerous. For example, someone with acrophobia will feel panicked even just by imagining being in a high place. Another example is social phobia, which is an excessive fear of negative judgment from others in social situations. Phobias often make sufferers avoid the feared things, even if it limits daily activities and reduces quality of life. In severe phobias, just thinking about or seeing the feared object can trigger an anxiety attack. Social anxiety disorder. Social anxiety disorder is a type of anxiety that makes someone feel very afraid and anxious in social situations, or when having to interact with others. Patients often feel worried about being judged, mocked, or embarrassed in public. As a result, they tend to avoid social gatherings, speaking in public, or even simple situations like eating in front of others. The accompanying physical symptoms can include sweating, trembling, blushing, and a rapid heartbeat. This disorder can severely limit a person's social life, work, and interpersonal relationships. Post-traumatic stress disorder. Post-traumatic stress disorder, or PTSD, is an anxiety disorder that develops after someone experiences or witnesses a highly traumatic event, such as a severe accident, physical or sexual violence, a natural disaster, or war. PTSD sufferers often experience vivid and painful memories, flashbacks, of the traumatic event, recurring nightmares, and feelings of detachment and emotional numbness. They also tend to avoid situations, places, or people that remind them of the trauma. Additionally, PTSD sufferers may experience heightened vigilance, be easily startled, and have difficulty sleeping. This disorder can disrupt social functioning, work, and overall mental health. Obsessive-Compulsive Disorder. Obsessive-Compulsive Disorder, or OCD, is an anxiety condition that involves repetitive, intrusive, and unwanted obsessive thoughts. These thoughts cause high anxiety. To alleviate the anxiety, the sufferer engages in compulsive behaviors or repetitive rituals, such as washing hands multiple times, checking doors or stoves repeatedly, or arranging items in a specific way. Although these behaviors only provide temporary relief, the sufferers find it difficult to stop them. OCD can significantly disrupt daily activities and lower the quality of life because sufferers get trapped in an obsessive-compulsive cycle. Agoraphobia. Agoraphobia is a type of anxiety characterized by an excessive fear of situations or places where a person feels it is difficult to escape or cannot get help if they experience a panic attack or other anxiety symptoms. People with agoraphobia often feel unsafe in crowded places, open spaces, or when alone far from home. Examples include being in a mall, using public transportation like trains or buses, or standing on a bridge or in an open field. In severe cases, sufferers may choose not to leave the house at all due to intense fear. This anxiety can severely limit daily activities and disrupt quality of life, so professional treatment is highly recommended. Separation. Anxiety disorder. Separation. Anxiety disorder is often associated with children, but it can actually be experienced by adults as well. This type of anxiety arises when someone feels afraid or very restless at the thought of being separated from a loved one, such as a parent, partner, or child. They can feel very anxious if their loved ones leave, even if only for a short time. The symptoms include excessive worry that something bad will happen to the loved one, refusal to go to school or work, nightmares about separation, and panic when the person is not in sight. When this anxiety persists and disrupts daily activities, special treatment is necessary. Performance anxiety. Performance anxiety, often referred to as stage fright, is an intense fear when someone has to perform in front of an audience or be judged by others. This type of anxiety is often experienced by musicians, athletes, speakers, or anyone who has to showcase their abilities in front of an audience. The symptoms can include an increased heart rate, sweaty hands, trembling, nausea, or even feeling the urge to escape before performing. Although it is part of social anxiety, performance anxiety is often discussed separately because it is very common. In mild intensity, this nervousness can enhance alertness, but if too strong, it can hinder someone's ability to perform well. Hypochondria. Health anxiety or hypochondria is a condition where someone feels very anxious about their health, even though no serious medical issues are found. People with this type of anxiety tend to focus excessively on normal bodily sensations and interpret them as symptoms of serious illnesses like cancer or HIV. They might constantly search for disease information on the internet, visit doctors repeatedly, or even be afraid to get checked because they worry about receiving bad news. These worries can last a long time and greatly disrupt daily life, as well as cause chronic stress. Psychological support or cognitive therapy can effectively help reduce this anxiety. Situational anxiety. Situational anxiety is an anxious reaction that arises due to a trigger or specific event that makes someone feel pressured or threatened. Examples of situations that often trigger this type of anxiety include job interviews, exams, presentations, or even after experiencing an accident. For some people, this anxiety is mild and only lasts for a moment. However, for others, the fear and anxiety that arise can be so intense that they cause physical symptoms such as dizziness, nausea, or shortness of breath. If situational anxiety occurs repeatedly and starts to interfere with daily life, psychotherapy or relaxation training can be very helpful.